Welcome to the Diffusion of Innovation Theory presented by Tiffany, Jennifer, and Cindy. The diffusion of innovation theory was developed in 1962 by Avery Rogers. Rogers specialized in communication theory and sociology, as well as being a writer and teacher. Rogers originally developed the diffusion of innovations as a communication theory to explain how new products, ideas, or behaviors are initiated and diffused or spread throughout certain social groups or populations. The diffusion of innovation theory described the spread of ideas and behavior changes as happening in stages. The four most often discussed regarding health promotion and dissemination, adoption, implementation, and maintenance or sustainability. Dissemination refers to the coordinated effort put spreading ideas or information. Adoption refers to either accepting or rejecting an idea or behavior. Accepting will result in a new behavior occurring, such as daily exercise. Implementation refers to an individual or population using the new idea or concept or actively engaging in a change behavior. Maintenance and sustainability refers to the ongoing use of the innovation, including identifying and addressing barriers to innovation when encountered. Rogers defined characteristics for different types of adopters. Innovators are interested in new things or concepts. They are willing to take risks and often require little convincing. Early adopters are often in leadership roles and embrace the idea of change. If they recognize the need for change, providing them with information on how change benefits and implementation will get them on board. The early majority adopter is not a leader, but still more likely to adopt change sooner than average. Early majority adopters likely need to see evidence that the innovation works before its adoption. Late majority adopters are often skeptical of change. They often need to see that the majority of the population or social system has adopted the innovation successfully. Laggards prefer tradition and resistance to change. They are the most difficult group to convince to adopt innovations and may need to be persuaded by statistics, pressure from peers or society, or even fear appeals. When considering spreading information or ideas with the objective of initiating change, factors of influence impact adoption of innovation and outcomes. Factors of influence include the advantage of the innovation, meaning what is the benefit to the adopter. Complexity and capability refers to the ability to actually adopt a new concept or engage in a new behavior. Observability of results reference the extent to which the benefits of the innovation can be seen. Social influences are influences, including how the innovation is being communicated to the target population. Additional factors include time, commitment, and risk associated with change. Although the diffusion of innovation theory was originally developed as a communication theory, it is applicable to public health and intervention planning. The diffusion of innovation theory is often applied during step 5 of intervention mapping, when dissemination, adoption, implementation, and maintenance program planning occurs. Contribution at this stage of planning include assisting program creators to identify desired program outcomes, as well as identifying who in the population are the adopter and who are the implementer. The diffusion of innovation theory can also be used at the stage to note what influences or barriers to adoption may occur and identify areas where improvement or additional support may be needed.
In the first case study we found, researchers worked to predict factors of elderly Chinese type 2 diabetic patients' adoption of wearable activity trackers. Using the DOI theory framework, they sought to identify patient intentions as well as actual behaviors. Using DOI frameworks to identify influencing factors and adopting behaviors, researchers found the following. Relative advantage indicated how useful participants found the trackers to be. Observability indicated how easily the benefit of wearing the trackers were observed. Compatibility linked patients' past experiences and habits with likelihood to adopt wearing trackers. Complexity reflected the effort required by patients, which needed to be charged and linked to a smartphone, increasing complexity, which may have an effect on adoption intention. A second study examined the adoption of pre-exposure prophylaxis among African American males who have sex with men. An item of note was compatibility, which may be perceived high by those with multiple partners, but low by those that consider themselves low risk. Complexity may be perceived as high by those not used to taking daily medication, as opposed to those already on a medication regimen. Consideration must be given to the preference of the individual of using a daily pill over a condom to prevent HIV, which some may see as an advantage. Trialability may be viewed as challenging since the pill must be taken daily to be effective. Finally, the outcomes of adopting the use of PrEP is difficult to be observed by those still considering medication use. Some pros we found when using the diffusion of innovation theory is the first case study looking at diabetes and the tracking device is the potential for identified influences to be relevant in regards to other health behaviors. A factor that influenced a participant to wear the device may also influence them to engage in other behaviors that aid in controlling diabetes. Additionally, identifying complexity and ability to try new health technology may guide researchers in other areas of advancement among an older demographic. The DOI theory also highlights the importance of monitoring the diffusion process at the community level and consideration of segmenting populations within specific DOI stages. Some cons with using DOI theory was that since activity trackers were given to participants at no cost, it is difficult to determine using behavior of the devices versus buying behavior of the device. People use them when provided, but that does not indicate they would purchase them. Additionally, the participants had few health complications, making physical activity more feasible. DOI theory cannot help determine the outcome of adopting behavior for higher risk patients. Even though no health theory is perfect, the diffusion of innovations theory can be used for interventions that have a limited amount of time to make an impact on entire communities. This model works best when applied to issues that can be influenced by prominent members of society or spread through traditional methods of communication. The DOI theory yielded significant results globally in areas like science, sociology, education, and the health system, and technology for innovative management improvement. The theory can also be used effectively to communicate innovation initiatives in health service delivery institutions. This is our infographic on diffusion of innovations theory. Here are our references. And that will conclude our presentation. Thank you.